Okay, so this is the human heart. Alright, so this tag should be down here. It should be the apex of the heart. So when it comes to it here. Okay, and then the other region of the heart, and it's tagged right here, number 2. Okay, really it could be anywhere up here. So, region of the heart, base of the heart. So base of the heart, apex of the heart. Okay, so then we're going to move into a layer. Visceral pericardium or epicardium is the same thing. So it's got this different color right here. It's the epicardium or the visceral pericardium. So it's the outmost layer of the heart. So we have number 18, which is the pulmonary trunk. Okay, so that's this guy right here. Okay. Okay, so the pulmonary trunk takes blood from the right ventricle up and then shoots it out to the lungs. Okay, so the next one is number 19. It's the pulmonary arteries. Okay, so when the blood comes up, it comes up the pulmonary trunk and then shoots out the pulmonary arteries, which is labeled right here, to the lungs. Arteries away. Okay, and then we have pulmonary veins. Okay, so that's when blood is brought back to the heart from the lungs. So it's right here. Okay, so it could be on both sides, but it's tagged right here. Pulmonary veins, bringing it back. Okay, and then 21, superior vena cava. Okay, so over here. So that's our superior vena cava. Okay, 22 should be our inferior vena cava. So that's this guy down here. See how they both dump blood into the right atrium. Okay, so right atrium, both of them are getting blood dumped into it by the superior vena cava and the inferior vena cava. Okay, so then we have the ascending aorta. So that's this guy right here. That's a region, right? Okay, and then we have the aortic arch. So like Kylie was saying, our landmark we kind of use is right below these top vessels, which we'll talk about later. It's the aortic arch. And then we have the descending aorta. Okay, so in the body it would sit like that, because it's carrying blood descending. Okay, brachiocephalic trunk. So these are the 3 blood vessels that come off of the aorta and bring blood to the superior portion of your body. Okay? And these we actually will talk about next week. They aren't going to be on your quiz for this next time, but they'll be on your practical and be on next week's material. So number 30 is the rightmost. So this is the rightmost. Anatomically, this is the rightmost. Okay? Brachiocephalic trunk. Okay, and then the middle one is the common carotid artery. So it's this middle guy.
Wait, what was that one again?
This one's the brachiocephalic trunk.
Okay.
And then this one is the common carotid artery, so it's the middle. And then 32 is the subclavian artery. Okay. It is. It's actually left subclavian and left common carotid, but we just have them as that on here. Okay, and then what do we have next? 33. Right coronary artery. Okay, so if it's an artery, it has to come off of the aorta. Okay. So we're going to look up here, and we're going to find it. So, 33. Right coronary artery, coming off of, anatomically, the right side of the aorta. Okay? And it's a little more muscular, okay, than a vein would be. Okay? Okay, 34, posterior interventricular artery. So we're going to flip it, right, to the posterior side, and then find 34, which is the posterior interventricular artery. So don't get confused. Okay, so this is it right here. So once again, it's like wider and a little more bouncy. Okay. 41 we'll talk about later, but you can already see that it's going to be a vein because it's a little bit darker color. Okay. So 35, left coronary artery. Okay, so this looks better than the models. Remember the models, it's just that little chip piece. Okay, so it looks actually better right here. So it should be 35. So that'll be up from there. Okay, so here's the left coronary artery. So it's right here. Okay. Because you can see that it's before it branches. So when it branches, what does it become, right? It becomes the circumflex, and then the anterior interventricular artery. So left coronary artery, way up top here, that little sliver again. And then we have 36 is anterior interventricular artery. And then this thing right here, they would both be considered it. Okay, so don't be confused about that. 37, circumflex, so that's the other split, right? So it's right here. Okay, so that would be the other way that it would split. So for your video, it's right here. Circumflex artery. Okay, labeled right here. So left coronary artery, that's your anterior interventricular artery, and then your circumflex artery. So 38, great cardiac vein. Okay, so it's right here. Okay, so that one's kind of hard to see, but that one runs.
Is it that entire straight?
Remember what we said about the great cardiac? So the great cardiac runs from the back and right here, but we just have it labeled right here. Right here. Okay. Okay. So 39, coronary sinus. So that's that big vein in the back. Right there. Okay. That's just right there and really vivid. 40, posterior cardiac vein. So the posterior is to the side a little bit, right? So 40. So it's over here.
Is that the number?
That's the
So it would go
posterior.
further down, but we can only see like that much of it on the surface. And then 41 is the middle cardiac vein. Okay. So that runs down the posterior interventricular sulcus.
This is the right atrium right here.
Thank you.